Hey everyone, I want to welcome you to my webinar, which is going to be discussing some of the lab clues that are hidden in your traditional labs that can give you information about some of those gut symptoms that you might be experiencing. So lab clues to gut blues. My name is Kimberly Wiest, and I'm excited that you're here. I'm excited for you to get this information. I think that, some of what we're going to be talking about is going to be something that you've probably experienced in the past. And this is going to sort of point you in the right direction, maybe explain why you got some of the answers that you got from traditional medicine, and maybe what they didn't tell you that was there all along in your traditional labs. So that is me. I am a nurse anesthetist by education. I've also been a nurse practitioner in the past, but currently have moved over to the functional medicine arena, and I have opened my functional medicine practice this year. So I'm so excited about that. So I just want to let you know that I do have experience, lots of experience in traditional medicine and experience in functional medicine as well. This is just a little bit about me. I'll tell you that I got to functional medicine because I saw that my mom was dealing with metabolic syndrome. She died early, having dealt with metabolic syndrome probably for the last 10 or 15 years of her life. She was on about 10 medications that didn't do anything to help her metabolic syndrome, and she died early because of that. So when I went through menopause, I started seeing myself go down that same path. I wasn't getting a lot of help from my traditional practitioners, and so I really started the deep dive on my own. I wanted to I wasn't willing to take medications, and I really was suffering a lot with menopausal symptoms. And I knew that there had to be an answer for that. So in that whole process of learning more about my body and how to heal it naturally, I stumbled upon functional medicine, and I jumped in with both feet. I feel like this is where God wanted me to be all along. I sort of feel like he's made this path for me. So I am so excited to be here. So that's just a little bit about me, how I got here. And then this is just sort of some housekeeping stuff. And I just want to let you know that this webinar is purely for informational, educational purposes. This doesn't mean that you and I are in a practitioner patient relationship, and that you really should talk with whoever your practitioner is before enacting any of the things that we talk about in here. Certainly, I can be your practitioner, but at this point, I am not. This is just for educational purposes. Okay, so let's get to it. I want to talk about maybe the scenario that you've experienced. You feel like dog poo. You go to the doctor. They run some labs. Your labs come back, and they're completely normal. And so your doctor just kind of, doesn't really address all of the symptoms that you're having, but tries to reassure you by the fact that your labs are normal. Doesn't do anything for how you feel. You still have those same symptoms. And it could be, so some of the things that we're talking about that aren't so obvious in your traditional values to a traditional practitioner, but we can get some clues about are things like inflammation, cravings, food allergies, weight loss resistance. Like those are all things that we can get clues about in your traditional labs. And certainly if you're having symptoms, then despite what your labs show, there's a reason for those symptoms. And that's really an SOS signal that your body is sending out, letting you know that something is not right. Okay, so let's talk about some common symptoms and why they're often dismissed. So those nagging issues that kind of disrupt you on a daily basis, like things that you're having to deal with on a regular basis, could be like bloating, belching, even joint achiness. Some people will have weight gain or inability to lose weight. And that's your body telling you that something isn't right. Yet when you go to the doctor, you get those labs back, they're telling you everything is normal. So the first thing that I want to, talk about is the fact that, normal is not necessarily the lab value. It just means that they're commonly seeing what you're complaining about. They're commonly seeing that these symptoms are things that people come to their office for. And so it's not to be confused. When they're saying normal, what they're just saying is that this is a common complaint. This is what we see. They're not saying that you having these symptoms is normal. So we don't want to get that confused. We need to be very clear in our language. Okay, so let's talk about the specifics and why you don't get a diagnosis in your traditional lab values when you're having these vague symptoms. First of all, when you go to your traditional practitioner, they are focusing on disease, not dysfunction. So the way that they're trained, the way that the labs are set up, like everything is really dictated towards defining or diagnosing you with a disease rather than understanding why you're having this dysfunction before you actually tip that threshold and get diagnosed with a disease. So if lab values fall within a normal range, and normal meaning an accepted range, outside of which there is a diagnosis for an actual disease state, then many doctors won't investigate that further. They're simply looking to see if you're within that normal range. And if you're within that normal range, that is pretty much it. They're not going to further talk about what symptoms you're having, when you're having them, what's precipitating them, what makes them better. Like that just doesn't really enter in, because they have this lab value that says that there's no disease state present. So they really stop their investigation at that point. And then if you've ever, gone to a specialist, you know that our traditional medicine practice is set up in very fragmented care. We have all these specialists, we do have some, general practitioners, some family practitioners that kind of see everything. But for the most part, if you have an ankle problem, you're going to go to either a rheumatologist or an orthopedist. If you have a problem with your kidneys, you're going to go to a nephrologist. If you have a problem with your gut, you're going to go to your gastroenterologist. And so they're looking at just a little slice of the pie, and they really do try to break you up into all these different body organ systems. And really, we're one big system. So if we're not having our practitioner look at us as a whole and examine us as a whole, then, a lot of things are falling through the cracks. So just a couple examples, I've most recently been in a nurse anesthetist, and in the operating room, we would have a patient that came in that was having a surgery done. And if there was anything outside of what that surgeon was operating on, they really didn't want to hear about it. So if the patient had an irregular heartbeat, or if the patient had noticed that she had yeast under her breast or in her axilla, or if maybe she had a bad tooth or whatever it was, if I would mention that to the surgeon, they would totally blow me off, throw up their hands and say, that's not what we're here for. That's not what I'm interested in. And so it just goes to show that we really do have this fragmented care. And a lot of times they're only looking at your symptom as to how it relates to that particular body system that they're an expert in. And so if there's not an obvious connection, then they think that what you're experiencing couldn't possibly be related to anything that they can help you with. So we also, again, we rely on these standard lab ranges. And so I just want to explain to you that functional medicine actually looks for an optimal range. And many times when your traditional practitioner is looking at your lab values, they're looking for a visual clue on your lab that your lab values are abnormal. They are, and not to beat up on our traditional practitioners, because if I am having a heart attack, or if I broke my ankle, I'm going to go to the hospital and I'm going to see a traditional practitioner. But they're not really educated, and the system is not really there to support them in order to manage, in order to prevent disease, or in order to correct diseases. They're really there to just manage that disease. And part of that is The fact that they are super busy, they're seeing anywhere from 30 to 45 patients a day. And so they don't have time to look at the individual numbers on your lab report. What they're looking for are those visual clues that tell them that your lab is either within normal range, within acceptable range, or whether it's outside of that normal range. And only if it's outside of that normal range are they going to talk to you about that. So how do we come up with those acceptable ranges? What's acceptable in traditional medicine is not the same as what's accepted in functional medicine. We're looking for optimal ranges, and those optimal ranges don't change. But in traditional medicine, the normal ranges might change over time, because how they're obtained is that they take all the labs, let's say all of the CBCs, for a cohort of patients. And that could be patients within that hospital over a certain period of time. It could be patients in that community. It could be patients in that state. It could be patients that particular lab has drawn over the last couple of years. I mean, I don't know exactly how all of the labs are set up, but there's a cohort of patients. So a number of patients that have all had the CBC drawn, and those values are all put into a calculation. And what they do is they determine what the middle 5% or the middle 3% is, and that is what the normal range is. So stick with me here, because this is important. So as our community is getting sicker and sicker, and you see it on the news, you see it on social media, a lot of places that you're looking, we see that cancer rates are up, that high blood pressure rates are up, obesity rates are up, cardiovascular disease rates are up. So as a community, as a whole, we are getting sicker. So if we're taking all of those CBC values, those values are leaning more towards sickness than it is towards health. And so those values are going to change. That middle 5% is actually going to change. In functional medicine, we're looking for optimal values. So there's testing and study that's been done that shows how the body functions optimally. So when we're feeling our best, when we're functioning our best, what should our lab values be? And that's what we look for in functional medicine. And then again, a lot of times, remember I told you that, these very specialized practitioners that have kind of cut you into little pieces, and they're just looking at their little slice of the pie. They will sometimes, the symptoms that we have can be seen as nonspecific. So if you go in with belly pain to a cardiologist, you're going to get an answer that might be related to blood pressure or blood flow or even a blood clot. If you go in with belly pain to your rheumatologist, they might not have an answer for you, because they can't see a clear connection to your joints or rheumatoid arthritis. Or if you go into your gastroenterologist, certainly they're going to have another set of ideas or options about what might be causing those symptoms. So when these are seen as nonspecific, a lot of times, and things like inflammation and joint pain and weight gain, or weight loss resistance is another big one. They are often seen as nonspecific, and they're also seen as they could be attributed to many different causes. And many times they think that those causes are things like attributed to just general stress or maybe lifestyle, but nothing in particular. So those symptoms, when they're pretty vague like that, they're not looking for how are they all related. They're looking and they don't see a common connection. So they're saying these are just vague symptoms, and they're nonspecific and not related. But what traditional medicine does is it takes these, nonspecific symptoms that you have, and we keep peeling back the layers, and we keep digging deeper until we find that connection where all of them are related, because that's usually what we find. So again, there's a limited focus on prevention. Like, how many times have you been to the traditional doctor? You're getting your, care, and you've talked about symptoms. Maybe your lab values are creeping towards diabetes, and they really They haven't told you a lot about any preventative kind of things that you could do, how to change your diet, how to do the exercise, what you should be eating, maybe what your macros should be. Like, they're not giving you any specifics. Instead, a lot of times what you'll find is that as they've sort of done your exam, listened to any acute symptoms that you have, either address those or not address those, maybe talked about what your lab values have shown, and then they have their hand on the door and they might say, oh, and stop eating sugar, and then they're out the door. So they're not really explaining, and their focus is not on prevention. So the importance of taking these symptoms seriously is that things like inflammation, cravings, food intolerances, even weight loss resistance can be very early warning signs of deeper underlying imbalances that, if they're left unaddressed, they can lead to more serious health issues. They can lead to actual disease. So functional medicine focuses on identifying, like I said, the root cause of these symptoms, often related to hormonal imbalances, gut issues, nutritional deficiencies, or even chronic inflammation. And they work to address those through a holistic route. And by digging a little deeper into these often dismissed symptoms, a more comprehensive and very individualized approach, individualized specific for you, to health can be created, leading to lasting improvements in energy, healthy weight, overall well-being. So we're really trying to get you to that optimal health. We're trying to get you not just surviving, not just managing a disease process, but we're actually trying to get you into thriving and really being vibrant and healthy. And like, who doesn't want that, right? I don't want to just skate by and manage my disease. I want to prevent that disease. I want to reverse that disease. Okay, so that's all great and good, but how do we get clues from the blood labs about our gut health? Like, it doesn't seem like one computes with the other, but I'm going to show you through this webinar exactly how we're going to do that. Okay, so we're going to address these things. What is gut health? Why is it important? What can traditional labs tell us? What functional labs do we need, and how are they different? And how do we find out more? Okay, so today we're diving into one of the most powerful yet overlooked aspects of health, and that is your gut. So whether you're struggling with weight loss resistance, fatigue, mood issues, or even autoimmune conditions, your gut health might be at the core of all of it. And I'm going to go out on a limb and say that if you have any autoimmune disease, that your gut is the culprit until proven otherwise. The exciting part is that you might already have some clues that are sitting in the blood lab results that your doctor ran. But functional medicine looks at those labs in a whole new way, and that's what we're going to find out. So why gut health matters? Your gut is more than just where digestion happens. It's the control center for your immune system, for metabolism, and even your mental health. So I say that because 70 to 90% of your immune system lives just outside of your gut. So if you think about it, if we're going to come in contact with a toxin or an infection, more often than not, we're actually going to ingest that. And so it makes perfect sense that most of the way that toxins or invaders get into our body is through our gut system. It makes perfect sense that 90%, up to 90% of our immune system lies right outside of the gut, so that it can be at the ready. It's that first defense against anything actually entering into the body. And it can drive chronic inflammation. So if you're getting these toxins or invaders coming through your gut, it can lead to chronic inflammation, autoimmune diseases, and even your ability to lose weight. And then there's also a gut-brain connection. So you might have heard that your gut is your second brain, but I'm here to say that our gut is probably our primary brain. And here's why. When we're in utero, when we're in our mother's womb and we are forming, our gut and our brain form at exactly the same time. And there is the biggest and the longest nerve connects those two. So there are direct messages that go from our brain to our gut and from our gut to our brain. And here's why I say that if that our gut might be our primary brain, because twice as many messages come from the gut to the brain as come from the brain to the gut. So if you've ever had like a thought about something and you get kind of nervous in your gut, that's that message. Or if you've ever had a gut feeling about something that stimulated a thought, that's that direct link between that vagus nerve. And then also, in that gut brain connection, about 70 to 80% of our feel good hormone, of our serotonin, is actually made in the gut. So if your gut is off, many people can be prone to anxiety or depression because the gut is off. And because those neurotransmitters aren't being formed like they should be. So when we're talking about what makes up gut health, we're talking about two key components of gut health, and that is cellular health of the cells that make up the gut. And then we're also talking about a balanced gut microbiome. And we'll talk about exactly what both of those are. So when we're talking about the cellular health of your gut lining, I want you to imagine. So a couple of things that I kind of want you to picture in your mind. We always think that when we put something in our mouth and we eat it, that we are putting that into our body. But if you can imagine just for a second that our body is like a roll of paper towels, and that our body is the paper towels, and our gut is the cardboard core in the center. Because it's a continuous tube from our mouth to our exit. So when we actually ingest something, it's not actually in our body, it's separate from our body. And the thing that separates it is our gut lining. And those cells are, imagine the strongest Velcro that you can imagine. That's how those gut cells are held together. They're like linking arms, and they're really making this impenetrable barrier, so that all the stuff that you ingested that is potentially potentially infectious or potentially toxic to the body is not getting into the body. It's actually creating a barrier to keep that from happening. And then imagine that if that barrier isn't intact, that what can happen is microorganisms or toxins or partially digested foods, any of that can actually leak through those tight junctions. What we really want, and I'll show you on this next picture, what we really want is this is the protective mucus layer, because we think about our gut as being this really kind of thick and tough organ, but in actuality, it's only 1 or 2 cells thick. And I'm going to explain to you why. So this is how digestion occurs, is that we have this mucus layer, you have these food particles, and you've got your good bacteria in here, and you've broken down the food by chewing it up. Enzymes are working on it, and now it's gotten to this part of the gut. And if you have a healthy gut, what's going to happen is the nutrients and the particles that are broken down to the smallest size are going to go through the cell membrane, and they're going to enter into the cell, and then they're going to go into the bloodstream. Okay, that's what we want. We want those nutrients, those carbohydrates, those fatty acids, those amino acids in their smallest form to get absorbed into the body, into the bloodstream through the cell. Okay, this is a normal gut. Now, look over here where we have an abnormal gut, and those tight junctions, that Velcro is not doing its job. So what happens is that instead of, number one, we don't have that good gel barrier layer, that mucus layer, and we don't have those tight junctions. So food can actually, instead of going through the cells, can actually go through these channels that are created when the cells are not right against each other, and it can get into the bloodstream. Things that should have been kept out, that are kept out by this barrier, are actually getting into the bloodstream. In this bloodstream right here is where 90% of our immune system lies, and that's when inflammation can get started. Okay, so chronic inflammation, once those invaders have been identified by the immune system, chronic inflammation can be initiated, and that's when we have those junctions that are broken, those tight junctions that are broken over a long period of time, and every day we're eating food that isn't completely getting digested, and it is actually going through those channels. So that is going to create inflammation day after day after day. So chronic inflammation can contribute to joint pain, skin problems, and even cardiovascular disease. And if it goes on for a long period of time, what happens is that because our immune system is so revved up, that it stops identifying our particular body cells as our body, and it looks at them as invaders. So it's just kind of madly trying to defend the body from all of these things that are leaking through those channels instead of going through the cells in the gut. And it is revved up. So it's got all of these antibodies that are circulating through the bloodstream, and it stops identifying our cells as our own, and it starts actually fighting our own cells. And that's when we have autoimmune disease. The other thing that can happen, so if you imagine that, one of the things that can actually trigger this inflammation is when we don't completely digest our food. And if we have an issue with these tight junctions and our mucus layer isn't intact, we probably aren't digesting well either. And so our food isn't broken down into the smallest particles possible. And so these bigger particles actually get through those channels, and our body, our immune system, recognizes it as a foreign invader and develops these antibodies to that food. And that's how you can develop food sensitivities as you go on, because your gut is not healthy. And here's just a picture representation of that, where you can see that you're eating something, it's in the gut, there's an opening, and a big particle of that food gets in. Your immune cells actually see it. They create these antibodies, and now you have this immune response that's going on. And the next time that you eat shrimp, you're going to have a reaction to it. You're not going to tolerate it well. And that can be things like gut symptoms, but it can also be that you get a headache. Remember that gut-brain connection. Okay, so now let's talk about the gut microbiome. So we talked about how the health of the cells can affect things outside of the gut, and now not only in the gut, but also outside of the gut, and really stimulate our immune system, but also the gut microbiome. So the key roles of the gut microbiome are food digestion, producing vitamins, regulating your immune system, and producing neurotransmitters. Okay, so part of the role of the microbiome is to help us to digest food. They help to break down the fibers and other nutrients that your body can't process on its own. So how digestion occurs, and I've alluded to it a little bit previously, is the fact that we are mechanically chewing up our food. So we really want to be sure that we're chewing our food more than just 2 or 3 chomps. We want to chew our food up well, and then we're swallowing it. And as it gets into the stomach, there are certain digestive enzymes in the stomach that are going to chemically further break down that food. And then as that juice leaves the stomach, it's going to enter into the small bowel. And then we're adding in these pancreatic enzymes that are further going to break it down. And then that's when that liquid gets presented to the gut cells, and we start absorbing things through those cells, or things start leaking through those channels. But our microbiome is an additional factor. So we have these microorganisms, fungi, bacteria that further act on the food that help to break it down. So what we didn't complete by chewing everything up, what our digestive and pancreatic enzymes didn't complete, then our microbiome is going to help us finish that digestion process, to break our food down into the smallest particles, so that it goes through the cells and not through those channels, and it's not going to rev up our immune system. It also produces vitamins. Certain gut bacteria produce essential vitamins like B12 and K2, which are critical for energy, blood clotting, and bone health. And those things are not going to happen without having a healthy gut microbiome. So if you don't have the right bacteria, microorganisms, and fungi living in your gut microbiome, then you're going to be deficient in these vitamins. It also helps to regulate your immune system. And we talked about the proximity of your immune system to your gut cells. And so if you have, again, we're back at this picture. So if you have that leaky gut, then things are going to leak through there rather than being held out. And it's going to come in contact with your immune system, and it's going to rev your immune system up to not only start acute inflammation that can lead to chronic inflammation, but also autoimmune disorders and those food sensitivities. And then our gut microbiome produces neurotransmitters. Remember, we have that gut-brain axis. Our gut bacteria help produce 90% of our serotonin, which is a neurotransmitter that regulates your mood. It's our feel-good hormone. So if our microbiome is not functioning normally, then a lot of times we can have people that are anxious, people that have depression. It could be a direct result from that unbalanced microbiome. Okay, so now we're talking about a little bit of dysbiosis. And so essentially what that is, the word dysbiosis just means an unbalanced microbiome. You might have seen it in things that you've read or in things that you've seen, maybe in print or on social media, but it just means that microbiome is imbalanced. And I don't like to say that we have good bacteria and bad bacteria. We have bacteria that should be in certain locations in the body. So we have certain bacteria that should be in our mouth and only in our mouth. We have certain bacteria that should be in our stomach and only in our stomach. We have certain bacteria that should be in our small bowel, certain bacteria that should be in our colon. And one of the things that leads to that imbalance is that we have an overabundance of some bacteria that should be in small amounts. We don't have enough bacteria that should be in bigger amounts. And we have bacteria living in the wrong areas. So any of those things could be diagnosed as gut dysbiosis. And so, when it becomes imbalanced, it can lead to an overgrowth of harmful bacteria, less of the beneficial bacteria, or it could mean that you're having symptoms because bacteria is living in the wrong part of your gut. This imbalance is linked to many chronic health issues, including nutritional deficiencies, thyroid disorders, weight loss, resistance, so inability to lose weight, and even mood disorders like I just talked about. And I love this picture. This is such a colorful picture about what our microbiome looks like. So nutritional deficiencies, an imbalanced gut can lead to poor digestion of key nutrients like iron, B12, magnesium that can contribute to anemia, fatigue, and muscle cramps. thyroid disorders. Dysbiosis can lead to a leaky gut that can contribute to the development of autoimmune thyroid conditions like Hashimoto's or Graves' disease. Weight loss resistance can come about because the microbiome is imbalanced and it disrupts our metabolism, and it makes it harder for our body to burn fat efficiently. There's a particular bacteria that should be in our microbiome called Akkermansia. And what we know is that when Akkermansia is in lower levels, when we don't have enough of that, we tend to be obese. And as a matter of fact, there is, let me get it back on that pretty picture. As a matter of fact, there is a condition called C. difficile infection, and that is a harmful bacteria that causes severe diarrhea. It can lead to overall body infection or sepsis. It can lead to nutritional wasting because you just can't keep anything in the body. You just have all this diarrhea. So one of the treatments for that is something called a stool transfer. And it's kind of a last ditch treatment, but it works so well. And I just hate the fact that it's kind of the last thing that we do. Maybe as we're recognizing more and more how important our gut is to our overall health, that this is not going to be a last resort for long. But if you've failed multiple antibiotic rounds, you've taken antibiotics multiple times and it's failed to improve your symptoms, then they'll do a stool transfer. And what they found is that if they transfer stool from a person who has a normal amount of Akkermansia, so they tend to be on a normal body weight or even on the leaner side, and you transfer it into a traditionally obese person, that obese person who's dealing with the C. diff will actually lose weight. Same thing, the opposite is also true. So if you have a person who has C. diff who is naturally more on the lean side, and you transfer stool from someone who has lower amounts of Akkermansia and tends to be more obese, then that person will gain weight. Even, this is how important the microbiome, even when they do those stool transfers, they've transferred stool into a patient that had Parkinson's from a patient who did not have Parkinson's, and their tremors stopped. So that's how powerful our gut microbiome is. And then mood disorders, because of our gut-brain axis, an unhealthy gut can increase anxiety, depression, and even brain fog. So those are all things that we've kind of talked about a little bit here and there, and that's just putting it all together. So how do gut health issues show up in traditional labs? So your gut doesn't just control digestion. It's involved in almost every aspect of your health. That's why with functional medicine, we look into the gut when we're addressing a wide variety of conditions. So if I have a patient that comes to me that says, I have brain fog, my thyroid, I have Hashimoto's thyroiditis, my joints hurt, and I feel really anxious, and foods that I used to be able to eat, I'm no longer able to eat. And they haven't told me anything about bloating, abdominal pain, constipation, diarrhea, none of that. They haven't told me any of that. I immediately am going to put all of those symptoms together, and I'm going to start looking for that root cause in the gut. And I am 99.9% of the time going to find a reason. And when we fix that reason in the gut, all of those symptoms are going to get better, all of them. So whereas traditional practitioners are not looking at how those are going to be related, I see that instant connection, and I focus it right in the gut. Okay. So now that you understand how critical your gut is to your overall health, let's look at how traditional labs can give us clues about whether your gut is healthy. And as we talked about earlier, some of the standard labs that you've already had done can reveal signs of gut dysfunction. And we're just going to recap with a little more detail about specifically what we're looking in those traditional labs. So the first thing that we are going to look at is a low white blood cell count can signal that you have that chronic inflammation going on. Remember, we're eating 2 or 3 times a day. Some people are eating 6 times a day. So we're eating, and if we have this leaky gut going on, then we're leaking potential hazards to our body constantly all throughout the day. And our immune system is always on alert, always fighting. And so over time, that's going to burden our immune system, and it's actually going to show up as low white blood cell count because we've really fought with everything that we have. And so now we're kind of living on reserves in our immune system because it's doing so much for us. So we can see a low white blood cell count. And then hemoglobin and hematocrit. So these markers can tell if your gut is struggling to absorb key nutrients. A low hemoglobin or hematocrit may point to malabsorption issues caused by gut inflammation or an imbalance in your microbiome. And then conditions like celiac disease or SIBO can prevent your gut from absorbing iron that can lead to anemia. So it could be in the way that our gut is not absorbing nutrition out of what we're eating. Eosinophils is another type of white blood cell. And if you have elevated eosinophils, that can be a clue that your immune system is responding to food sensitivities. So you've had that leaky gut going on for so long that bigger particles, you're not digesting well, bigger particles of food have actually made it through those channels instead of getting absorbed as it should through the cells. And that what we're finding is that the immune system has created antibodies, and part of that whole allergic sensitivity response is the production of eosinophils. So you can see high eosinophil count on your white blood cell. Even platelets, abnormal platelet count can also point to chronic inflammation, which might lead back to your gut health. And when inflammation is persistent due to gut issues, your blood's ability to clot and to respond to injury might be affected, because that's what our platelets do. So when our platelets get used up because of that chronic inflammation, chronic immune system being revved up, then we're going to use up all of those components of our blood. Okay, so CBC values that point to gut issues. Again, hemoglobin and hematocrit. Low values could point to nutritional deficiencies. It might also show us that you don't have enough digestive enzymes, because part of being able to digest those nutrients out of our food is that we have the right amount of digestive enzymes, not only in our stomach, in our mouth, but also in our small bowel. Neutrophils, which is the small little particles that is what our immune system originally immediately sends out. It's the guys on the front line of our immune system, and it's the main defense against bacterial, viral, or fungal infections. So high levels could mean stress, it could mean intestinal parasites, or it could mean leaky gut, like leaky gut that just got started, sort of that acute phase, like right when our gut starts to leak. Low levels might signal that our immune system is fatigued, our immune system is worn out, and that we've had this chronic low-grade inflammation and long-term infection that our body's been trying to fight for a period of time. Lymphocytes are also, there's 3 major types. There's T cells, B cells, and natural killer cells. This is a part of our adaptive immunity. So when we're exposed to a toxin or an invader or an infection, our body's going to create these cells so that when we're exposed to that again, we have this immediate response, and that we have these antigens, we have these antibodies floating around that can cause an immediate reaction and kill those invaders. So those are our lymphocytes, and that's when you can see high levels during acute infections and active inflammation. And then monocytes. So monocytes are they act as scavengers. It's almost like it's our white blood cells that have legs, and they kind of walk through our body, and they're looking for bacteria and foreign particles throughout the body, and they're going to engulf them and kind of chew them up, kind of like Pac-Man. And then on our comprehensive metabolic panel, A low albumin might indicate chronic inflammation or liver dysfunction, which could be a result of ongoing gut issues. And then elevated liver enzymes could suggest toxin overload, because our liver is one of those things that helps to detox our body. Not only does it detox the actual toxins themselves, but it also helps our body to get rid of those white blood cells and even red blood cells that have been used up in that fight, or that immune fight, and it has to get rid of those. So our liver is sort of our wastewater treatment plant of the body. And if we have a lot of inflammation going on, and we have an infection going on, or we have this chronic low-grade inflammation going on, there's a lot of debris that's created that our liver has to take care of, and that can affect the liver enzymes that the liver produces. So it could suggest toxin overload or metabolic stress, and it might be tied to gut dysfunction or even dysbiosis. And then there's vitamin and mineral deficiencies, like we talked about before. If we don't have enough of that intestinal fire, which is our ability to digest because of the digestive enzymes or the pancreatic enzymes that we have, one of the things that we can find is that we have low B12, we have low vitamin D, or we have low magnesium levels. And that could all be related to the fact of we don't have those the right amount of bacteria and microorganisms living in our microbiome, or we don't have enough of those chemical enzymes that are breaking down and absorbing, and we're not producing those vitamins and minerals. Also, blood sugar markers, hemoglobin A1C and fasting glucose. Our microbiome helps to regulate our blood sugar. And so when our microbiome is off, or when our gut health is not normal, when we have that inflammation, which is causing stress throughout the body, that can cause our blood sugars to be dysregulated. It can cause them to be high. And we can see that through our fasting glucose and our hemoglobin A1C. And then again, we have our thyroid panel, and that's going to be thyroid dysfunction, particularly hypothyroidism, especially if it's something called subclinical hypothyroid. Many times our traditional practitioners will examine and look at the thyroid function only by looking at the TSH, and that only tells part of the story. So a lot of times, your values will be within that normal 5% range of traditional values. But when we look at optimal values, it's a much more narrow range, and they are outside of that optimal value range. And so that's why we diagnose hypothyroidism in functional medicine, excuse me. And again, that inflammation starts from leaky gut. It gets our immune system revved up. And then those immune cells go out and they stop recognizing our own body tissues as our own, and it starts to fight off those tissues. And one of the organs that is most commonly threatened and most commonly fought against by our own immune system is our thyroid gland. Okay, so I wanted to show you. So we've talked about, let me go back just for a second. We've talked about what we can find in our traditional labs that actually point to gut issues. But now what I want to do is I want to show you that there are functional labs that we get that look at how our gut is working. And these are things that a functional practitioner is going to order. These are not things that your traditional doctor is going to order, because they haven't been trained this way. They haven't been educated about what these tests are, how to read them, the information that it shows. So that's why, things that a lot of the symptoms that you're dealing with, your traditional practitioner is saying, your labs are normal. I don't know what to tell you. When you go to a functional practitioner, they have ways of looking, and we're digging deeper so that we can find that root cause. So I'm just going to show you a little bit about a stool test that I often order on my functional medicine patients that tells me about the health of the gut. So on this first page here, this would be a lab that your doctor could run, your traditional doctor could run, but this is all that they're going to get. And essentially what they're looking for is bad guys. They're looking for pathogens, things that really shouldn't be in your gut at all. And that's what they're looking for. That's all that they're looking for. So things like C. diff, like we talked about before, E. coli, like we hear about whenever there's a food breakout where food is contaminated. A lot of times that it makes people really sick and can actually kill you, is E. coli. And it always tends to be lettuce for some reason. I don't know why. Enterococcus, Shigella, Salmonella. Like these are things that we hear on the news as contaminating food. It's like food-borne illnesses and breakouts. It can show some parasites. Those are 3 just common parasites that it looks for. And then some viruses, adenovirus and norovirus can show up on these. This person has none of those, which is good. And then another test that you might have done maybe at your gastroenterologist's office when they're looking because you have heartburn or you have acid reflux is that they'll look for H. pylori. And H. pylori, the reason that is important is because if you have it, number one, it can be transmitted between people like in the same household. So if one person gets treated for it, but everybody has it, they just don't have symptoms from it, then they can reinfect the person that had symptoms and got treatment. So when one person gets treated, everybody really should be treated for H. pylori so that you can eradicate it from the household. But H. pylori can actually cause or lead to an increased risk of stomach cancer. And it's not all H. pylori. It actually has to be a virulent. So it has to have some particular characteristics to it that make it more virulent or more potent, if you will. And this person had a little bit of H. pylori was present. She wasn't having any symptoms from it, but she had none of the virulence factors. So she really wasn't at increased risk of stomach cancer from the H. pylori. And then what we're looking for are keystone bacteria. And when I talk about that, a lot of our microbiome, we inherit it from our mothers. We get it in breast milk. We get exposed to it, in those very first few days, few weeks, few months that we're alive. And those are our keystone bacteria. And there's certain ones that we want to have in our keystone. And one of those is that Akkermansia that I was telling you about that can affect whether you tend to be on the leaner side or whether you tend to be more obese simply because of your microbiome. This person is actually pretty much in the middle of all of those. She's starting to get a little bit abnormal in her Akkermansia, and she did have a little bit of issue with her weight. But I'm just showing you that I'm not just looking to see that everything's in the green, because pretty much everything is in the green here. I'm not looking at just those visual clues. I'm looking at exactly where it is, and I'm matching it up with the symptoms that she has. One of the symptoms was that she's having a difficult time losing weight. She's weight loss resistant. So here we have one explanation in this Akkermansia, and one of the keystone bacteria is deficient that might explain that. And if we replenish that, not through a stool transfer, but actually through giving her a supplement, then we can help her to release some weight. It also shows some bacteria that are in here. And this is going to show, these are 2 types of bacteria, and we want to look at the ratio of how these 2 are into each other. So Firmicutes is one of those things that can actually cause us to extract more calories from our food. So if our Firmicutes is high, we tend to be obese as well. And hers are all normal, luckily. And then see how much more information this functional medicine lab is giving us about our gut. All that your traditional doctor is going to find out about your gut was living on that first page. Do you have any pathogens? And we're getting all of this other information about keystone bacteria. And we're also looking for parasites. We're looking for worms. Those are all things that can live in your stool. And remember when I was talking about those digestive enzymes that live in your mouth, in your stomach, and in your small bowel? These are some of those. And you can see that her steatocrit is a little bit on the low side, excuse me. And elastase is also one of those digestive enzymes, and she actually has a good amount of that. Beta glucuronidase is also something that can depict if you have a higher risk of developing inflammatory bowel disease. I'm not talking about like IBS, like constipation, diarrhea. I'm talking about inflammatory bowel disease like Crohn's disease, ulcerative colitis, proctitis, those kinds of things. And hers is normal. And then we're also looking for blood. And then secretory IgA is one of those things in our microbiome that is responsible for how that mucus layer is in the gut. Remember, we're only 1 or 2 cells thick, and so we really need that mucus layer to provide that extra amount of protection for us. And hers is actually very low. So there are some things that we can do, some supplements, some ways of eating that we can do that will actually help to improve that. Anti-gliadin, there is 2 parts of the wheat kernel are gluten and gliadin, and gliadin can oftentimes lead to inflammation. It can lead to food sensitivities, and hers is actually normal, but she does have eosinophilic activation. So there's something that's causing allergy within her gut, and hers is actually pretty high. And then we also can look at calprotectin, and calprotectin is a marker that when it's elevated, it shows us that we need to do some further investigating, possibly with a colonoscopy, because there is something going on in the gut that's leading to inflammation, possibly cellular changes that we need to be sure that we investigate a little bit further, giving us all kinds of clues about our gut health. And then, so when this is right here is showing us dysbiotic overgrowth of bacteria. And this person actually has staph and strep that is overgrown in her gut. So we actually did a protocol where we killed this off. But it can show multiple things. So it also shows those bacteria that can be responsible for autoimmune and inflammatory things that are going on in the body. And then here is also another subset of those bacteria that can give us clues if you have joint pain, or if you have skin issues, or if you have, if you're noticing that you are retaining water because you're sort of inflamed. This can give us a clue about that. Again, it's going to show us fungi and yeast. So if you, candida is often a culprit if we have sugar cravings, because sugar is what those yeast love to eat on. And they actually use that gut-brain axis, and they send direct messages to the addiction center in our brain that causes us to physically crave more sugar to keep that candida alive. That's how smart our bodies are. It's crazy. Viruses can also be shown there. So you can see that there's a ton more information that shows up in a functional medicine gut test, but we do get clues about what's going on in the gut just from our traditional blood labs. And it could really kind of point us in the direction of ordering this GI map to really get to the root cause of what's going on, what's causing your inflammation. Why is your thyroid out of whack? Why do your joints hurt? Those sorts of things. Why can you not release that weight? Why do you continue to gain weight? Why do you have that brain fog? Why are you anxious? It can all come from what we find in the GI map, but also what we see in those traditional labs. All right. So I wanted to go over a quick case study with you. My patient's 56 years old. Her initial concern was a lot of skin issues, some mood fluctuations, and some joint pain. Her health goals were to focus on her gut health for overall well-being. I give a lot of talks at my church, and she actually went to one of those talks, and it was enough for her to realize that she probably had some stuff going on in her gut, and she wanted to get to the bottom of it. Her health goals were to focus on her gut, like I said, for overall well-being. And she really just noticed that like she was never going to get any younger, and her health was kind of a little bit out of control. And so she wanted to do what she could at this time to get as healthy as she possibly could going forward. So when we first started working together, she was obese. Her BMI was almost 48. And remember, getting healthy was her primary goal. Weight loss was just a bonus. So she said, hey, if I lose some weight, I'll be happy about it. But I don't want to focus on weight loss. I want to focus on getting healthy. And so our initial findings, those were her GI map findings. So it showed dysbiosis, leaky gut, poor digestion. And then after working on me and working on the making her gut more healthy, we replenished some of those keystone bacteria that she was missing out on. We killed off some of those opportunistic bacteria that didn't need to be there. We replenished some of the things that needed to be in higher amounts. We actually helped get rid of, yeast, those kinds of things. So she's down 55 pounds at the time that I wrote these slides. She's lost 7 inches in her waist. Her sleep has improved, so she's sleeping well. She feels rested when she wakes up. Skin issues completely resolved. Joint pain fully alleviated. And her mood is more stable, and it's improved overall. Blood pressure is consistently in the low 100s over 60s to 70s. And she's even talked to her primary care doctor about discontinuing her blood pressure medications. They're going to be doing that. She just wants to see how she does over the next 6 months, but her pressure is actually perfect. And then on her lab results, what we've shown is that she has decreased chronic inflammation because she gets her labs drawn because she's a person that donates blood. So they check her labs every time that she donates. Reduced liver congestion, normalized thyroid function, and improved digestion. All of those, we were able to follow up her traditional labs rather than repeating her GI map. But we were able to see all those improvements in her traditional labs. So I just wanted to let you know that I do have some happy customers, some happy patients, which is, just a blessing to me. Like I said, I feel like I was sort of pointed in this direction by God, that this is really where I can do the most good. And I can actually see that I am really making a huge improvement, not me. Functional medicine is making a huge improvement in the lives of my patients. Not only are we preventing disease, but we're actually reversing disease. Again, another happy customer. So the whole purpose of this is to offer you an opportunity for me to have a look at your lab values. Traditional lab values that you've already had done, maybe symptoms that you've had that your doctor just kind of brushed off because your labs were all within that normal range. This is an opportunity for you to have me look at those lab values through a functional medicine lens to see if I can show you where you may be having issues with your gut. And what that's going to look like is you're going to send me labs from the past year, and I'll review them to reveal what's hidden. And you'll get personalized insights from what I see and a clear path forward for better health. $97 to have me look at those lab values. Now, we're not drawing labs. I'm actually just reviewing labs that you've had drawn. And if you want to book me to actually look and review those labs, here is the there's a link down here, but here's the QR code that you can take a look at. And then I also have health benefits of eating the rainbow. That's just going to help to improve your gut microbiome. It's also going to help to improve your nutrition. But that's a free handout that I'll be sending to you once you've registered for this webinar, and you're going to get that. It's automatically going to be sent to your email. Again, if you want to download the guide now, here's the QR code to do that. And I'm just going to back up one more time in order for you to be able to work with me to look at your traditional labs and what they might be hiding about your gut. That's the QR code. And thank you so much. I absolutely love what I do in functional medicine, and I love really getting down and digging deep to find the root cause of what you have going on. And I am someone who gives you the time to explain what's going on. And I know that all of those seemingly unrelated symptoms, they're all related. And many times they point to the gut. So I hope to see you soon in a lab review, and thank you for tuning in.